The phrase, beauty is only skin deep, emphasizes the importance of skin to the physical aspect of interpersonal relationships. Skin is the largest body organ and accounts for over 10% of the body weight. To hide its imperfections, emphasize its assets, and increase its allure, Revlon, Maybelline, Avon, Mary Kay, and other companies offer a broad range of products for the eager consumer. Many individuals also spend considerable time and money on the other two main components of the integumentary system, hair and nails. For the more adventuresome, willing to accept a permanent change, there are tattoo parlors and cosmetic surgeons willing to make the consumer look however they would like to, for a fee. No other system is subjected to elective surgery to the same degree as the integumentary system. It is, after all, the main system that we each present to the rest of the world.
Hi, I'm Mike Shively. Welcome to Introduction to Anatomy and Physiology. Today we're going to talk about the integumentary system. Now, this system is extremely superficial when you get right down to it. Everything is on the surface of the body. And it only has three major components, and you heard those mentioned in the pre-taped video segment: skin, hair, and nails. Those are the three major components. Actually, hair and nails are epidermal derivatives of the superficial layer of the skin, and so this is really a relatively simple system from that standpoint. The skin, however, is the largest body organ. This is a by weight comparison, and so that is one unique distinction that the integumentary system has. Let's take a look at a graphic that makes sure we have those three major components down now: skin, hair, and nails. And I say major components because, you know, skin actually has several glandular structures associated with it. And so we will consider those when we talk about skin. Let's see if we can collectively make a list of the functions of the integumentary system. What sorts of things does the integumentary system do? Amber?
Protects the body.
Okay, physical and chemical protection. Physical protection from microbial invasion, chemical protection as well. And along with that protection thing, it helps keep what from happening? If I lose a bunch of my skin, this is a severe problem. Susan, what?
Well, it keeps everything inside. I mean, structure.
It encapsulates.
Encapsulates, yeah.
Let's see, have any of you ever, silly question, wrestled on the living room floor with a brother or sister?
Oh, yeah.
Uh-huh. And somebody ended up with a what? A rug burn. And if it's a severe rug burn, what happens in that area within, actually just a few minutes? What starts happening? Eva?
Kind of start leaking clear
Starts
fluid.
leaking. It starts leaking. If our skin is not intact, we leak, because the skin actually helps prevent dehydration. And without the skin in place, some of the tissue fluid will actually begin to seep to the surface of the body. And of course, that makes that particular area very vulnerable to microbial invasion and infectious process. Many of you have probably experienced a minor rug burn of some type at one time or another that didn't seem all that severe, and so you didn't bother to put a Band-Aid or some antibiotic ointment on it, and then over the next couple days it turned into kind of a nasty situation and caused you considerable grief. All right, so we got the protection thing, helps prevent desiccation or dehydration. Can you think of some other things? Eva?
Does it help with thermoregulation?
Thermoregulation is important, integumentary function. When we get overheated, what color do we turn?
Red.
We turn pink or reddish because blood vessels near the surface of the skin, close to the surface of the skin, actually dilate, and the pink or red color is due to the increased amount of hemoglobin in red blood corpuscles that's present as our body attempts to radiate some of that heat away. Also, when we get overheated, there's some glandular structures in the skin that go into gear. What are those? Sweat glands. Sweat glands serve an important thermoregulatory function in the skin as well. You think of other functions. Adam?
Works with the nervous system to develop sense of touch.
There are a lot of specialized sensory receptors that are located in the skin. Several, that as a group, we call any sensory receptor that's found in the skin a cutaneous receptor. And we have receptors that are either in or very near the skin that are responsive to heat and to cold, to pressure, to touch, to even what we call pain or nociceptors. There's some of those located in the skin as well. Think of any other functions. Seth?
With exposure to sunlight, we produce vitamin D in our skin.
With exposure to ultraviolet light, some of the oils in the skin interact with that ultraviolet light to produce vitamin D. That's true. Something else that's often mentioned in regard to functions of the integumentary system is communication. You'll see that in a lot of texts, and it's kind of an interesting concept. How many people do you know that can carry on a major kind of in-depth conversation just using their skin? I think we can certainly express certain kinds of things, but I don't think it's a major organ of communication in the sense that it's sometimes presented. Let's look at a graphic and see how we did when we tried to make our list verbally. We mentioned thermoregulation and hydroregulation, physical and chemical protection, sensory reception, vitamin D production, and even nonverbal communication. I guess we listed this whole list when we talked about it verbally. Let's when we think about skin itself, there are really only two major layers to it. The outer part is called epidermis, and the deeper part is called dermis. Those two things together make up skin. Now, deep to the skin, there's another layer of tissue called hypodermis. So epidermis and dermis, those two are skin. Deep to that yet, we have hypodermis. The epidermis is actually stratified squamous epithelium. The dermis is actually connective tissue proper. And the hypodermis, which is deep to the dermis, is connective tissue proper as well. In fact, the dermis and the hypodermis kind of blend together. Do you know any other names for hypodermis, incidentally? Susan, do you know one?
Yeah, subcutaneous tissue.
Hypodermis is also called subcutaneous tissue. Can you think of another name? Eva?
Was that superficial fascia?
Superficial fascia. Hypodermis, subcutaneous tissue, superficial fascia. Those are all the same substance, really. And that is the tissue that actually connects the skin to underlying structures. It kind of binds the skin in a relatively loose manner over most parts of the body, because you know that you can move the skin about and shift it about relative to underlying structures to some degree. Did you have a question, Susan?
I did. I was the epidermis, isn't that not alive or doesn't have blood?
Well,
is that right?
That is correct. Since the epidermis is stratified squamous epithelium, you remember all membranous epithelia lack blood supply.
Right.
So there's no blood supply. The deeper layers of the epidermis are actually living cells, and the more superficial ones are actually dead cells that are continually sloughing off.
So
Let's
that's
go.
what we see as dead cells?
Pardon?
We see everybody's dead cells instead of live cells.
The ones that are on the surface that we actually see, those cells are actually dead.
Mm-hmm.
Let me put on the overhead camera those names. Well, actually, let's go to this graphic. I got a graphic up here that'll do this for us. Let's go to a graphic on skin. Epidermis is stratified squamous epithelium. Under it, and still part of the skin, is the dermis. That's connective tissue proper. And then we ought to draw a big line here, really, because I want to make the distinction that this hypodermis is not skin. I say it here in parentheses. It's also called subcutaneous tissue. It's also called superficial fascia. Let's take these layers and talk about them one at a time. First, we'll begin with epidermis, and let's go to the overhead camera, and we'll make a little bit of a drawing here. Stratified squamous epithelium, if you'll recall, it's several cells thick, and the surface cells are kind of flattened. But the cells down at the basement membrane, I'm going to write BM to remind myself that that's supposed to be the basement membrane. These cells down here are actually kind of cuboidal in nature, right next to the basement membrane. These are the deepest cells. And on top of those, we have other layers of cells. And actually, there are several dozen layers of cells. Now, I'm not going to bother to draw several dozen layers, but as we get toward the surface, the cells begin to flatten out. And so finally, when we get to the absolute surface, several dozen cells thick altogether, the cells on the very surface are actually squamous. Now, several dozen layers of cells here. The bottom layer, right next to the basement membrane, is called the stratum basale. And those cells are living cells that are actively mitotic. They're actively dividing. This just says basal layer, if you translate it into English. Stratum basale, basal layer. The few layers of cells directly above it, now I've only drawn five here, 5 layers of cells, but actually there would be several layers of this next type. The next layer up is called stratum spinosum. And the cells of the stratum spinosum layers are still alive. Matter of fact, some of those are dividing as well, actively mitotic. And they're given this name, spinosum, because in microscopic section, when you look at through a microscope at a section of skin, the cytoplasm kind of shrinks away from adjacent cells. The cytoplasm shrinks away from one another such that they look like little porcupines. They look like little prickly pear cactus in a manner, because they have these little spines that stick out where the cell membranes were actually tightly adhered one to another. Now, these two layers together are sometimes called collectively, since they both are actively mitotic, they're sometimes called the stratum germinativum. You'll see that in the literature, some anatomy and physiology texts. Stratum germinativum. And that just means germinal layer. So that term actually applies to these two taken together. Now remember that there's no blood supply in membranous epithelium. Where do these cells get their nutrition? Where do they, how do they stay alive? Susan?
Doesn't blood supply come up through the basement membrane?
Well, there's no blood up here, but down here where we have the dermis, deep to the basement membrane, there are blood vessels in the dermis. And so actually what happens is nutrients from the blood vessels in the dermis diffuse up through the basement membrane and keep these bottom few layers of cells alive and healthy. And that's how they're actually able to maintain life and able to divide and so forth. Eva?
So do those cells have like gap junctions or something?
Yeah, there's some specialized connections between the cell membranes. They're not gap junctions, but there's some tight junctions and so forth, things that we're not actually going to talk about today, but we may have briefly mentioned some of those specialized connections between cell membranes when we talked about epithelium. Now, when we move on up, the cells start getting far enough away from the underlying dermis and blood supply that these cells in this region up here begin to die. They are actually dying. And because when they start dying, the cytoplasmic organelles all start clumping together. When you look at these through a microscope, you get an impression that there's granules in the cytoplasm because the organelles are all kind of clumping together. And so histologists have called the next several layers of cells stratum granulosum because it looks granular in appearance. So let's go back to the overhead and I'll write that, stratum granulosum. These cells are dying, and their organelles are clumping together to make what appears to be granules in the cytoplasm. Finally, in skin over most parts of the body, we have several layers of cells that constitute the layer called stratum corneum. And these are the outermost cells. The superficial cells in the stratum corneum layer actually continually flake off and are lost. So basically we've got cells down here at the deep layers that are actively dividing, and some of those cells get moved slowly but surely toward the surface, and then eventually they slough off, they become dead, they die and flatten out, slough off. Now the stratum corneum is called that because within the cytoplasm of those dead cells actually, there's a very tough protein that develops. It's called keratin. Let me go back to the overhead camera and write that. It's supposed to be an R. This is a tough, abrasion-resistant protein that's found within the cytoplasmic area of these dead cells in the stratum corneum, and that's what gives skin some of its abrasion resistance. Now there's a limit to that, If you go into the briar patch, you can get torn and ripped, but nonetheless the skin does have some resistance to tearing and abrasions. Now all areas of the body have at least these 4 named layers in the several dozen total cell layers that are thick in the epidermis of the skin. However, in the real thick skin that's found in the palms of the hands and soles of the feet, there's another layer right here between the stratum corneum and stratum granulosum. And in that very thick skin, again, palms of hands and soles of feet, there's a layer in there called stratum lucidum. And it's given that name because in microscopic section it has a very clear appearance, a very lucid, if you will, appearance. So we say that the epidermis of the skin has either 4 or 5 layers, depending on where you are, but the total named layers, but the total number of cells thick is several dozen. How long does it take a cell down right next to the basement membrane, one of those stratum basale cells, to get shoved clear up to the surface where it's ready to be sloughed off, flattened out, dead, ready to be sloughed off? Does anybody have any idea? We're not going to try to get an exact number of days here, but okay, let's make this multiple guess, and maybe it'll make it easier. What if I said 12 hours, a few days, several weeks, 6 months, or a year? What do you want to guess?
Probably
Couple
a
weeks.
few days.
I guess
Few
a few
days.
days.
Oh, we're guessing, aren't we?
Oh, yeah.
Typically, it's a few weeks. Few weeks. Okay, remember we got dozens of cells, so I don't want you to get the impression that when you're walking down the street here, you're losing lots and lots of cells. I'm sure the total number is very large, but percentage-wise, you're not losing very many cells at a time sloughing off the surface. It takes a few weeks for cells to move from the basement membrane all the way to the surface and be sloughed off. All right, let's talk about skin color. What are the, well, before we go into that, let's take a look at a graphic here that summarizes the layers of the epidermis. Stratum basale, stratum spinosum, stratum granulosum. Lucidum is the layer that is present only in the very thick skin of the palms of the hands and soles of the feet. And then the superficial layer, the one that's right on the very surface, again, is the stratum corneum. And it's the surface cells of this layer that are sloughing off. All right, any questions about those layers? Let's go back to that same graphic one more time if we can, because I want to emphasize something else too. I want you to take a look at this thickness. The total thickness of the epidermis is 0.07 to 0.12 millimeters. So it's about roughly 1/10 of a millimeter thick. That's the epidermis. So it's really quite thin, really quite thin. And it's obviously thicker in some areas than it is in other areas. Okay? Now let's go underneath the epidermis and talk about the dermis for just a bit. The dermis is connective tissue proper, CT proper. What was the other term that we used for CT proper, connective tissue proper, before? Remember? Long time ago? Fibrous connective tissue. How quickly we forget, right? Of course, if it were on the test tomorrow, we'd know it for 24 hours at least, wouldn't we? Connective tissue proper, or fibrous connective tissue. Well vascularized, so it's got a good blood supply. And we previously mentioned today how when we are overheated, those blood vessels will do what? They'll dilate in an attempt to radiate some of that heat from the body. When we get really cold, those superficial blood vessels will actually constrict down. We'll have less blood flow near the surface of the body, and that's an attempt to maintain, body temperature in a homeostatic type mechanism. The layers of the dermis are divided into two. This graphic will show us the names of those. So we'll go to this graphic. Papillary layer, which is the superficial layer right next to the epidermis, and the reticular layer of the dermis is the deeper layer that's actually continuous with the underlying hypodermis. So this one's next to the epidermis, and this one's next to the hypodermis. Okay? Any questions there? All right. Skin color. There are actually several different pigments that contribute to skin color. The single most important one probably is a pigment called melanin. Melanin is a black pigment that's produced by some cells called melanocytes. Let's go to the overhead camera so I can write that word for you. These are the cells that produce the pigment melanin. And the melanin is a black pigment, and basically all parts of our skin have some melanocytes in them. In some individuals, the melanocytes produce more of that black pigment than they do in others. Now, if you happen to have very light-colored skin, you're considered to be light-complected, you sunburn very easily, then you have less melanin production than someone who is more darkly colored. And obviously there are racial overtones to that too. If you have a real lot of melanin produced, you'll be a black-skinned individual. If you have quite a bit of melanin, but not as much as we just said, you'll be brown-skinned like some of the Latino individuals would be. So that produces the varying shades, of skin color. In addition to that, hemoglobin that's present in the red blood corpuscles close to the surface of the body that hemoglobin has a certain degree of influence over skin color. And you know that when you're really cold and you've got blood vessels near the surface of your skin that are constricted down, you may have kind of a pale appearance. Unless, of course, you've been out in the wind and are windburned, in which case you may appear pink. And then finally, there's a yellowish pigment called carotene, found in carrots as well as some other vegetables, that gives a yellowish color to especially the Oriental races. Susan?
I fed my daughter so many sweet potatoes and carrots when she was a baby. She started turning yellow,
yes,
orange.
There can be some dietary influences.
Yeah.
Now, when we go out into the sunlight and the ultraviolet light starts interacting, with our skin, that ultraviolet light actually induces the melanocytes to produce more melanin. And so that is the basis, for a suntan, interaction of the ultraviolet light in the sunlight with melanocytes. Let's take a look at a graphic. Oh, do you have another question?
Well,
Sue?
I was just going to say, isn't that our body's way of protecting
It is, as a matter of
it's
fact.
really not a good thing to be a suntan.
It's interesting. When I was a kid, nobody ever said anything about that, and so I was out in the sun all the time. Fortunately, I haven't had any skin cancers yet, but I'm expecting some to arrive, just any moment. But today, we really emphasize how important it is to protect our skin from that ultraviolet influence, and perhaps it's better to try to get a darker color in other ways. Let's go to this graphic that summarizes these three pigments then. Melanin, black pigment, carotene, yellow pigment, and hemoglobin, the iron-carrying red-colored pigment present in red blood corpuscles. All three of these then interact in a given individual to produce their particular skin tone or color. Amber?
So what causes freckles when you get out in the sun too long or whatever? What causes those freckles?
Those
to
are
appear?
localized areas where melanin production is pretty high, and some individuals freckle and some individuals don't. Some folks, when they go out in the sun, all of a sudden have a crop of freckles that come up. Others go out in the sun and just get a uniform tan. So it's a good question. I'm not sure what the micro answer is down in the epidermis specifically, but that's the short answer, the quick answer. All right. Skin can become infected, and the name for skin infection is dermatitis. When you have a skin infection, we say you have a dermatitis, but there are a lot of different things that can cause dermatitis. Let's look at this graphic. Certainly you can have a traumatic dermatitis. How about that rug burn that we talked about earlier, right? That would be a traumatic dermatitis. Go through the briar patch and get all scratched up, that would be traumatic. Lay your Harley down on the middle of the interstate, that's traumatic dermatitis. Heat and cold can both cause dermatitis. In heat, obviously, we talk about that being a burn, and we talk about first-degree burns, second-degree burns, and third-degree burns. Anybody know what the distinction of those three levels of burns are? Yeah.
First degree is just redness, no blistering. Second degree is actually blistering. Third degree is destruction of the skin and the innervation to it.
That's exactly right. And of course, first degree burns are painful. Second degree are quite painful. And third degree, of course, are even worse. But the big thing in regard to those is how much of the total skin surface area was involved. Even a third degree burn is relatively not a very serious injury if it only involves a very small area on the body. On the other hand, severe second degree burns or even severe first degree burns can be quite a problem if they involve large portions of the body surface. Let's go back to that graphic rather. Cold, specifically here we're talking about so cold that we get frostbite type injury. I mean, you can be cold, but it's not really damaging unless we start getting ice crystals that start forming. And quite often the skin itself may be the least of our concern in regard to the damage that occurs under those circumstances. We've already mentioned how ultraviolet light can cause burning. Sunburn, if you stay out in the sun too long, it's actually the ultraviolet that causes that. Kind of interesting, you can't get a sunburn through glass. Have you ever noticed that? No matter how bright a sun you're in, if you're in a car and your arm's right next to the window and the sun's shining in on that all afternoon because you're making a long road trip, you won't get a burn because glass blocks or stops the ultraviolet rays. Hypersensitivities. What kind of things will we be talking about here? Eva?
Things like contact dermatitis.
Contact dermatitis, and can you name
Like-
one?
well, and no allergies to latex or maybe poison oak, poison ivy.
Poison oak, poison ivy, hypersensitivities to latex, those are good examples. Contact dermatitis, you bet. And the last thing I have on this list is infectious organisms. Obviously, particularly if the epidermal surface is excoriated to the point where we get down into the dermis, then microbes can have a pathway to get into the deeper tissues of the body and can cause infectious processes. Now, where there are particular names for certain kinds of traumatic skin injuries. A cut. Anybody know what a cut is called? Susan?
Laceration.
A laceration. A cut is a laceration. And what about a scrape? Adam?
An abrasion.
An abrasion. A scrape is an abrasion. Now, if you get a real bad scrape to the point where you're on some rough pavement that's tearing out chunks of you, and you go back and you say, oh, there's a piece of me right there, and there's one over there under that rock. Those kinds of severe deep scrapes where there's actually tearing away of body tissue, those are called avulsions. Avulsions. And then one that we are real concerned about is a puncture wound of the skin. And why are we so concerned about a puncture wound? Does anybody know, Adam?
Well, it goes very deep and doesn't close up.
Well, what if it's just a real small puncture wound? It's just a little nail that I stepped on, you know, and yeah, it went in, and I'm not bleeding from the hole, you know. Is that still a serious concern, maybe, Eva? What?
Yeah, I think it has to do with the bacteria that can get in there because they don't need much air, so the bacteria in that little hole they have a nice dark spot to grow in. And
sure. One
cause
bacterium that we're
tetanus is
particularly
usually-
concerned about is Clostridium
tetani.
tetani. Those are obligate anaerobes. In other words, they can only divide, you know, in anaerobic or no oxygen type conditions, and puncture wounds may provide that particular environment for them. Interesting thing about Clostridia, the tetani organism in particular, is they're ubiquitously found in the soil. They're present. So if you step on it's not the rust on the nail, incidentally, that's of concern. But if you step on a nail that's been laying out in the dirt, has some just plain old soil on it, there's a good chance that there may be some Clostridium organisms that will then get injected by that nail, if you will, into the deep tissues, and the oxygen levels in there are low enough that the Clostridium then can divide and thrive and start producing the particular toxin that causes tetanus. Tetanus. I can remember when I was about 9 years old, I had an incident wading barefoot in a creek with some kind of a object that cut my foot pretty good, and so they gave me at that time an injection of tetanus antitoxin, which is in fact made in horse blood, in living horses. And of course that was the first injection of horse serum that I received. And then several years later I received another one after having an altercation with a dog, as I recall. And I went into anaphylactic shock because I had developed antibodies against the horse proteins, and that second tetanus antitoxin injection just about did me in. Adam?
Do they manufacture that in horses instead of foodstuff animals so that if you develop that hypersensitivity, you can still eat? I mean, do you understand what I'm saying?
Oh.
Do they do it in horses instead of cows because we eat cows?
No, that's not the reason. Horses just happen to be where they originally developed the serum. They actually have used other animals as well, and it's not eating that particular protein that would bother you, because when you eat a protein itself is broken down to amino acids before it's absorbed into your bloodstream. So even if you eat a horse steak, you know, it's hard to find those on the menu, at least in this country, but even if you'd eat a horse steak, if you were hypersensitive to horse serum, it wouldn't bother you at all because it'd be broken down. Now, I'm hypersensitive enough that if I just get horse blood on my skin, I break out in welts because I'm that reactive to it. Susan?
So how did they develop that vaccine now?
Oh,
Do
they still
continue to
use
do horse
what they
serum?
typically do, Susan, is, and what I do is I get a tetanus toxoid injection, which is actually killed or attenuated Clostridium tetani organisms. So I make my own antibodies directly to the organism rather than getting the gamma globulin injection that tetanus antitoxin would consist of. Does that make sense?
Mm-hmm.
So now, the antivenin for pit vipers is classically another horse serum. So, you know, if I get bit by a rattlesnake, for example, and they determine that I need some antivenin, then I have to get the kind of antivenin that's made, in this case, in, say, an ox. So I'd have bovine serum. I haven't been exposed to that yet directly, to my knowledge, so I should be able to take that at least the one time. All right, let's take a look at this graphic and make sure everybody got the words written down. Laceration is a cut, abrasion is a scrape, an avulsion is when chunks of tissue are torn away, and a puncture wound, well, that's obvious. Let's talk about the glandular structures that are associated with the skin. Now, you all know that we've got sweat glands, and you know that there are thermoregulatory in their functional purpose. But are you aware that we have two different kinds of sweat glands? We have sweat glands that have their pores, their openings almost all over the surface of our skin. And then we have sweat glands that are different, that open only in the armpit areas and in the groin region. And the first kind of sweat glands is called merocrine or eccrine sweat glands, and the second kind that are found only in the groin or armpit regions, those are called apocrine sweat glands. The eccrine, the first kind, that are found almost all over the surface of the body, those actually begin functioning early on in life, and young children have actively sweat-producing glands over most of their body. But have you ever noticed that even though little kids sweat, those little kids don't stink that much, do they? And it has to do with I don't know if you can remember back to when we talked about glandular epithelium, but there are three modes of secretion for exocrine-type glandular epithelium. And eccrine, basically no part of the cell per se is lost, no visible part of the cell is lost in the secretion. And so the sweat that those particular glands produce contains no dead or rotting cell parts, if you will. But apocrine sweat glands, the ones that are found in the armpits and groin areas, those actually have broken off chunks of cellular material per se that are in the secretory product. Now, it's intriguing that the reason little kids don't stink even though they sweat is because their apocrine sweat glands do not become functional until puberty. Seems like the sex hormones are involved in the maturation of those apocrine-type sweat glands. In addition to sweat glands, we have oil-producing glands, and their little ducts typically open into hair follicles. Purpose of that oil, it's called sebum, incidentally. The purpose of that oil is to keep the skin soft, pliable, and waterproof. There's some modified wax-producing glands that are present in the external acoustic meatus. That's the external ear canal that we talked about previously. Those are called ceruminous glands, and I think we mentioned a couple things about their secretory product when we were talking about ears. Finally, their mammary glands produce milk, and they are actually a kind of a modified sweat gland, if you will, and they are apocrine in their secretion as well. So if we take a look at this graphic that'll summarize what I just said as far as the different kinds of glands, we have eccrine sweat glands and apocrine sweat glands. We have sebaceous glands that produce oil, ceruminous glands in the external acoustic meatuses of the ears which produce wax, and mammary glands, which of course produce milk. Let me bring up a model of skin, and we'll take a look at it on the overhead camera, and have that camera kind of look down on it, and we'll look at some of the components here. Out here, and it's kind of small layers, but these layers out here are the layers of the epidermis, and they've got 5 of them there. And then this kind of a, I don't know, does that look maroon to you? This color right in here. This is the dermis. Okay. Here's some sweat glands. They've modeled 2 different kinds, so we're going to assume that they're trying to show maybe an epicrine, eccrine rather, type sweat gland here perhaps, and then maybe an apocrine over here. Then we can see some other structures that we're getting ready to talk about here. Here's a hair coming out. The hair itself is not living cells. It's dead, flattened epithelial cells similar to the stratum corneum type cells. But the cells down here around the buried portion, the structure that we call the hair follicle, those are living cells. And there's actually several layers of them. As the hair grows out, the non-living portion is actually extruded through the surface of the skin. I want to draw your attention to this structure right here. Here's another one right here. These are piloerector muscles. These are smooth muscle fascicles that attach to the base of a hair follicle, and then they're kind of anchored out in the dermal region here, or kind of at the junction of dermis and hypodermis. When these contract, they actually cause the angle of the hair follicle, and thus the hair shaft coming out of it, to change a bit. And they torque this thing around a bit. And of course, when that happens to you, you get a bunch of these doing this at the same time, then you get little bumps out here that you say, oh, I've got what? Goosebumps. I've got goosebumps. I don't know if geese ever get people bumps or not, but nonetheless, causes this cutis anserina, which actually says goose skin when you translate it. You get that when you're chilled sometimes, that will happen. It'll happen sometimes if you have a fright, under certain sympathetic type responses, you'll get the goosebump reaction. Now, we don't have a real major purpose for that reaction in our lives, because even if we erect this hair, it's not going to trap enough air to keep us significantly warmer, because we don't have enough hair scattered out over the surface of our bodies to do that. But imagine yourself being a small kitten, and in the next yard over, there lives a German Shepherd, okay? And when cats are confronted with in a hostile situation, typically in a form of a dog, what will the cat do? He'll fluff himself up and try to look as absolutely big as possible. And I guess the purpose for that is to try to convince this marauder that he cannot possibly engulf in his mouth this smaller kitten. At any rate, let's go back to this model for just a second now. Epidermis, dermis, down in the hypodermis is where these hair follicles are actually anchored. And you can see that the hair shaft itself actually has an enlargement down here called the bulb. And then we got the shaft extruded out. And finally, the tip out here is called the apex of the hair. All right, I just wanted to show you that some of these other structures here are various sensory receptors that they're trying to model in, and I don't really want to spend any time on any of those right now. Seth?
Yeah, when an individual gets a tattoo, in what layer of the skin are they depositing the ink so it doesn't go away?
Yeah, they've got to put that down in the dermis/hypodermis, because if they put it in the epidermis, it'd be lost after a while. So that goes down into the dermis. Yep, good question. Let's talk a little bit more about hair. We got hair all over our body, but there's specific names given to hairs in certain locations. These hairs out on the top of our head are called capilli. These that are right here, what constitutes what we call our eyebrow, these are called supercilia. Eyelashes are called cilia. Nose hairs are called vibrissae. Armpit hairs are called hirsi. I'll show you these words in just a minute. I just want to show you the specific names. Facial hairs are called barba. And you know when babies are born how they have a really fine hair on the surface of their body? That's called lanugo. Lanugo. Let's look at these different types in a graphic here. That's the one we just mentioned, lanugo. That's the very fine hair on the body of a newborn. Scalp hairs, eyelashes, eyebrow hairs, facial hairs. Oh, here's one we didn't mention. Ear hairs, trachea. Nose hairs. We didn't mention pubes either, pubic hair. And hirsi we did, armpit hair. Now we got 9 types up here. Which of these continually elongate? Which of those 9 types continually elongate? Then we have to trim them back once in a while.
The capillae.
What do you think, Hazel?
Capillae.
Capilli? You bet. We get our hair cut once in a while. And
Barbie.
Barbie in men, right? Typically not in women, but in men. Hair color. What are the things that contribute to hair color? Eva.
Aren't there pigments just like in skin?
There are pigments. They're not just like in skin except for one, really.
The melanin.
Melanin. Melanin is the critical pigment that contributes to hair color. A lot of melanin, black hair. Let's look over here at Hazel for just a second. If the camera can go over to Hazel. Hazel has this beautiful, really black hair. And if we go next to Hazel and look at Adam for a second, Adam's got pretty black, not quite as black as Hazel, but it's close, okay? And then if we keep scanning around, let's go to Amber. Amber's got dark brown hair, doesn't she? Okay? Now let's go across the room and look at Eva for a minute. Across the room, there we go. Eva's got a little bit of red tint to her hair, doesn't she? Okay, and we're going to assume that's natural. It may be, it may not. We're not going to ask. Okay. Now, if we scan over to Seth a little bit there in the middle between Eva and Susan, Seth's got pretty black hair. And notice that it's curly. All right. Can the camera go back to Hazel for just a second? I just want to show you a difference here. Camera back to Hazel. There we go.
There we go.
Now, Hazel's got black hair and it's straight. And then we just looked at Seth. He's got black hair. He got some curl to his, okay? And then if we go down to Susan, Susan's kind of got brown hair with some highlights in it and some reddish tints, okay? And we won't ask. We won't ask.
Well, we know the highlights are.
Oh, we know the highlights are unofficial,
That's an
right?
obvious.
Okay.
Yeah.
Now, interesting thing. Most hair color is due to varying amounts of melanin. A lot of melanin, black hair. Less melanin, brown hair. Less melanin, blonde hair. Okay? Reddish color is due to an iron-containing pigment. In addition to the melanin, there's an iron-containing pigment there called trichosiderin. And camera's on me right now. What color hair do I have, more or less? White. More or less white, isn't it? You know, it was dark brown until about 2 years ago, you know. But then I had to deal with the children, you know, getting the last 2 kids out of the house. It just turned it white overnight almost. Interestingly, when you get white or gray hair, what's actually going on is a relative lack of pigment. There's essentially no pigment at all left. In fact, the hair shaft is hollow and has air in there. And so the older you get, the more of an airhead that you technically become, I guess. My kids have told me that for years, so but there's some, I don't tell them that there's actually some truth to the matter. So the white color is not actually a pigment, but just a lack of pigment and with varying amounts of air inside the hair shaft. Now, we took a look at Hazel a little bit ago with her beautiful straight black hair and looked at Seth with his curly black hair. I want to show you what causes that, and I want to go to an overhead camera for just a second here. If the hair shaft in transverse section is pretty round, this kind of translates to straight hair. If the hair shaft is flattened out, kind of oval, this will be curly. If the hair shaft is really quite flat in transverse section, what do we want to call this? Kinky. How about kinky? So the natural character of the hair as straight, curly, or really tight. Maybe we should call this wavy and this real tight, curly. I don't know. Use your own words, but you understand what I'm trying to get across here. It's basically the shape of the hair shaft and transverse section that naturally determines that. Now, obviously, we can add a bunch of, across-the-counter pharmaceutical products from the drugstore, and we can change color, we can change the character, and so forth. But thought you might be interested in that particular feature. Anything else about hair that you'd like to talk about, Amber?
They do laser surgery to try to remove hair so that it doesn't grow back. What does that do to the hair follicle?
Yeah, the living cells, or the hair itself, is any part of the hair that you can see. That's all dead cells cemented together. The living cells are actually down in the follicle. Now, when you pull a hair out, and you say, well, I pulled it out by its root, because you can maybe see some soft tissue coming out right around what was buried part, you're not getting all the follicular cells. So pulling a hair out in that manner will not prevent it from regrowing. But if they go in there with an electrolysis needle, or if they go in there, they've probably got some laser techniques that they're using now, will go in there, they can actually destroy all of the living follicular cells, and then that hair will not regrow. It won't regrow. Adam?
Why does some hair that doesn't normally elongate really bad as you get older start to ear hair?
Like ear hair, and I'm getting up to the age where I've noticed, I never used to have a problem with ear hair, and now, every once in a while my wife and daughter grab me, tackle me down the living room floor, and one sits on me while the other takes the tweezers and jerks these things out, while I complain vociferously during the whole procedure. I'm not sure what's going on there, but certainly in the aging process, part of the senescence, there must be some microchemical changes that say to these guys that haven't been elongating for your whole life to suddenly begin to do that.
Could
Susan?
that be hormonal changes as you grow
Yeah,
older?
when I said the microchemical, I'm talking about some
Okay.
hormonal differences. Let's talk about, well, let me make sure that we've got those names of those pigments. I didn't write them down. On hair color, let's go to this graphic. Melanin, I think we talked about that one before with skin, but there's the way you write trichosidrin. Again, it contains iron, and you know that iron has in certain forms has a reddish color to it. And then air contributes in the elderly to the gray or white color. I want to talk about nails just a bit, and let's go to the overhead camera. There's not a whole lot that I want to say, but let me just draw a nail here, and we'll say this is on the end of a digit. The nail itself is just a modification of the stratum corneum of skin. It's basically stratum corneum cells glued together. And the part down here that continually elongates and then we clip off once in a while or file off, it's called the free border of the nail. This part up here that's underneath the cuticle is called the blind border because you can't see it. And then these two sides of the nail, both are called lateral borders. That has to do with the fact that there's a kind of an axis that comes down through the middle of the digit. So this is perhaps the medial lateral border over here on this side, and this would be the lateral border over here on this side. It's one of those funny things that anatomists have done. So those are the sides of a nail: free border, blind border, and the two lateral borders. Now, quite often, and you can look at your own digits for this, there's kind of a discolored area kind of a lighter area down here near the blind border, and it's kind of half moon, semi-lunar shaped, and kind of light in color. It's called the lunula. I don't know if the camera can come down on my thumbnail tight enough. Let's see if we can zoom in on it. But I've got a lunula right here on this thumb. I don't have a lunula on the nails of my other digits here, but I've got one right here. Some people will have a lunula at the base of the nail on each one of their digits, so you can check yourself out on that. Have you ever had one of these, and of course the nail actually grows from this buried portion up here. There's some germinal epithelial cells, and it slowly but surely slides distally. Now it takes several months for a given area on the nail to grow all the way down. Some of you maybe have mashed your finger and had a blood blister thing that occurred here, and you've then gotten to watch it as it moved slowly but surely down and finally off the end there. I drilled a hole right here one time it was unintentional, of course. Yeah, my little Makita cordless went through a piece of wood, and I had my thumb on the other side. And then it bled a bunch. I put some antibiotic on it, and then I had a little defect that appeared, and then pretty soon I had a round color or shaped defect. It just moved right on down over a period of several months and off the end. Now, have you ever run a splinter up underneath a fingernail? Now, those really hurt, don't they? There are a lot of sensory nerve endings that actually attach the nail itself to the underlying dermis. And when you get a blood blister from a hammer job or something else, maybe leaving your fingers in edge of the car door area and then slamming the door on them, and get those little hematomas underneath the nail, those are very, very painful. Incidentally, if you get one of those, don't just live with it and then suffer the pain and take the Advil. File or drill through the nail itself down into that area, and as soon as that blood has a release point, the pain will instantaneously be gone. So, at any rate, we spend a lot of money on the integumentary system, hair, skin, and nails, because again, as we mentioned at the beginning, that's the system that we present to the outside world. All right.